Good day, I'm Dr. Pierre Jansen van Vuuren from MSD Animal Health, and today I'm going to talk to you about the correct application techniques for certain animal health products. Before starting with any animal handling or treatment protocol, make sure that the facilities that you use are in good working condition. This decreases the time of the animal spent in the crash as well as stress. It also decreases the chance of injury for the handler. Also make sure that before you use any product, you read the package insert with regards to dosage, administration and any other special precautions. It's advised to make sure that all equipment, product and facilities are ready to go before you start handling the animals. This reduces time spent in the crash by the animals as well as stress on the animals and the animal handlers. In this video we will be discussing the subcutaneous injection of an animal. A short needle is used, usually 1/2 inch to 3/4 inch, 16 to 18 gauge. Make sure that the needles are sharp and that the equipment that you use are in working order. The preferred site for subcutaneous injection is the neck area. It can also be done behind the elbow or at the base of the tail. The area is demarcated at the bottom of the vertebrae, the point of the shoulder and the jugular groove. When giving a subcut injection, take the skin, tent it, insert the needle at the base of the skin fold, inject, remove the needle, and you're done. When you're injecting more than one product, make sure that they're at least a hand's width apart. In this video we'll be discussing intramuscular injection. Two areas are used for this technique, one in the neck area and one in the rump area. The neck area is preferred to the rump area, as the rump area is the most expensive cut of meat and we don't want to damage it. The area is demarcated by the bottom of the spine, point of the shoulder and the top of the jugular groove. If the rump is used for an intramuscular injection, the landmarks are the hip bone, base of the tail and the sit bone, right in the middle of the muscle. When we administer an intramuscular injection, we usually use a larger needle. It's either a 3/4 inch needle or 1.5 inch needle. Before injecting the animal, desensitize the area to make the area less sensitive for the animal, and then keep the needle perpendicular to where you want to inject. With one quick motion, inject and withdraw. The next technique I'm going to explain is the pour-on dip. The most important is the weight of the animal to prevent over and underdosing and to rule out any detrimental effects of the product. Dipping when rain is expected must be avoided as the effect will be minimal. The applicator or dip gun must be properly calibrated, the animal's dorsal line reasonably clean and correct amount of product must be drawn up. Apply the product evenly from the base of the head to the base of the tail. The next technique we're going to explain is drenching. Make sure that the gun that you're using is correctly calibrated and make sure that the hook is free of burrs or any sharp ends to prevent injury to the animal. Then you must make sure that the animal is correctly restrained as to prevent injury to the drencher and the animal. Make sure that the drench is aimed at the cheek and that you don't do it too fast because that can cause aspiration. In this video we will be explaining the correct ear implanting technique. It is of paramount importance that the restraint of the animal is done correctly. If not done correctly, this can lead to serious injury to the implanter as well as the animal. Before implanting, make sure that the gun that you're using and the needle is sharp and clean. And also make sure that the ear is free of mud or feces. This can lead to bacteria entering the wound and causing an infection and the implant not working optimally. The correct implanting technique and place is behind the ear, between the two cartilages, in the middle third of the ear. Insert the needle underneath the skin, taking care not to do it within the two cartilages. After removing the needle, pinch the hole for a few seconds to make sure that that hole is closed so that the implant cannot escape.